Welcome, everyone, to another edition of SCRC's Let's Talk Caregiving. I'm your host, Roberto Velasquez, President and CEO of SCRC, and I'm here as always with my co host, Marta Rayon, our Executive Vice President. Hi, Marta.
Hi, Roberto.
Today we have a very special guest. Her name is Kerry Rogers. Kerry is one of SCRC's clinical supervisors who oversees our agency's psychoeducational programs, among other things. Particularly, Kerry is here to talk to us a little bit about a new program that's being offered at Southern Caregiver Resource Center called Caregiver TLC, which the TLC stands for Thrive, Learn, and Connect. And we're really happy to have you here joining us on this podcast this time, Kerry.
Thanks so much. I'm happy to be joining you as well.
Roberto, am so excited that Carrie's here. I know my team is excited to really connect people in the community to this service that is very unique and very new to the community. I know that in the past we've had other programs that have been very beneficial to families, especially those caring for someone with Alzheimer's, dementia, and memory loss. So I wanted to hear from Carrie if you can talk a little bit more for our audience to kind of learn more about the TLC program and how they can get connected.
Yeah, absolutely. So TLC is a 6-session psychoeducational class for family caregivers whose loved ones have a diagnosis of Alzheimer's, dementia, or other forms of memory loss. And so this class is specifically targeted to the caregiver and increasing the well-being of the caregiver, in the midst of their caregiving situation. So it doesn't so much focus on the hands-on caregiving, though those are really important skills. What this focuses on is the emotional and mental well-being of the caregiver. So it's some time for them to focus on themselves and taking care of their own needs.
Yeah, thank you for saying that, Kerry. Our agency's been around since 1987. Our programs that we have, our services, our assessment tools, our validated instruments over the years, and of course, they're all evidence-based practices that we have in place to help families better care for their loved ones at home. But consistently since that period of time, and with the data that we've collected over the years, multiple decades now, one of the constant things that families need is education. Family caregivers need education. But like you said, it's not necessarily just about how to lift, how to feed, how to deal with behaviors. Education is also very important about their emotional health, how they're coping with their caregiving situation. Nobody says, I want to be a caregiver when I grow up, but yet that happens. And then it's almost immediately exhausting, especially when you're dealing with somebody with Alzheimer's disease. So programs like the Caregiver TLC program are really important, I think, for family caregivers.
How can they access these services and do they have to do in order to become a participant?
Sure. So if someone's interested in taking the class, it's really as simple as calling SCRC or sending an email, to our main agency email address to get you connected to one of the family consultants. And the family consultant will then walk you through an individualized assessment to talk about your specific situation and what supports and resources you might need. They're then going to send you some personalized resources and get you fully enrolled in the class.
So I wonder if can people call and maybe they don't know that this is the class that they should be participating in. Would you be able to help them assess?
Absolutely. So if someone calls in because of an interest in any of our programs, the intake coordinators are going to do a thorough assessment of figuring out what are the best services and supports for each person. And so if they're noticing or if there's a conversation about some of these aspects of caregiving being stressful or feeling overwhelmed, our team will connect you to the specific TLC team to make sure you can get enrolled in the class.
And again, these programs are so important. Kerry, maybe you could share with us any anecdotal kind of stories with us about how, or any feedback we've had from people who've taken the class, how it's impacted them. Maybe not specifically, but in general, if you have any examples, because I think that our audiences would love to know that.
Yeah, so one of the things that I think is most impactful about the class, of course, we're practicing mindfulness, we're practicing relaxation, we're learning a lot of different skills. But one of the most impactful things for a lot of people is that it's a safe space to talk about things that can feel taboo or that can feel challenging to talk about. And you have this space with other caregivers who are going through something similar. So one of the classes actually focuses on managing feelings of anger and frustration. And it's amazing every class, just how much people express it benefits them to be able to even say the words, yes, sometimes I get angry at my mom or at my dad or at my spouse. And that's not something that people who aren't caregivers can sometimes even understand. And there can be a lot of emotion that gets wrapped up in that. So just the space to freely express all of those emotions and to be able to know that you can really be open about your experience, be open about the challenges. Like you said earlier, people don't, say, oh, I hope that one day I'm spending 40 hours a week doing caregiving. It's something that is kind of thrust upon us, and we don't have much say in when it happens and how it happens. And that can just be really, abrupt and challenging. So it's really nice to just have that space to connect with other caregivers and process those emotions.
I am glad that you are giving people a safe space to do that, because I know that as a former caregiver, and I'm sure a lot of people out there are afraid to express themselves. And it's a very human reaction. We are dealing with stressful situations, emotionally draining circumstances. And so to be able to say, right now, I'm really upset, or I'm really tired, or I'm really stressed, and it's okay because we recognize that it's difficult. And I think that's what I want people to understand. The classes that my team puts together, the self care classes, and how to navigate some of these topics that are relevant to caregiving, really go hand in hand with your team's programs, Kerry. And I really like that, because I think it really supports what you're doing, but also supports people in different ways, right? So somebody might say, well, I don't know if I can do this class right now, but let me start off in this other way, maybe taking a class with me or my team, and then realize that they could probably benefit from signing up to the classes that your team does, Kerry. And I think that's so wonderful for people to be able to feel safe to do that.
Yeah, thank you, Martha. One of the great things about SCRC is that we're always putting together programming, tailoring it to our communities, so that we can really have an impact and benefit of the families that are caregivers, who are our clients, right? The family caregivers are our clients here at Southern Caregiver Resource Center. And I think about our Calma program, which is the program that is the Spanish version of the REACH program, another evidence-based program. And the Calma program, we've been offering it since 2009. And even statistically, the number of people that have gone through that program, we've been able to show over time that the individuals that go into that program, if they really improve their health, and by health is their mental health and well-being overall, we've had significant statistics showing that people who go into the program who score really high on depression, or who score really high on burden, or who score really high on the number of problems that they're experiencing because of the behaviors or memory problems that their loved ones have. There's those scores. Actually, after taking these classes, we track it, and we can show that it's helping, because then their scores are less. they've reduced those scores to a point where if you would think of somebody going in clinically depressed into one of these programs, chances are, because these programs are evidence-based and they're very structured and incredibly powerful topics that are being taught, that they come out and they're less depressed, or maybe not even clinically depressed anymore. So it has had a major impact. We've seen it through the REACH program. We've seen it now through the Calma program for all these years. And I'm excited because the Caregiver TLC program, we're just starting to roll it out, right, Kerry?
Yeah, that's right. So we just started our first class in these past 2 months, and there was a really positive reception to that class. And it's really exciting too because this Caregiver TLC program was actually developed to be a fully telehealth program. And so, when as everyone had to pivot and adjust and change things and adapt things because of COVID, that sometimes can make it difficult to translate things to a virtual format. This program was specifically designed to be virtual. So it's a really smooth process for clients and for facilitators. And it's really great to be able to offer it, to people who are even anywhere in the county, regardless of how far away from our office you might live. You can hop on and participate in the class each week.
I love that accessibility, Kerry, because it is true. I think we're now in a different era where we are offering things in a varied platform. And I remember thinking back when you were saying that when I was a caregiver, to be able to commit so many hours to an in-person class when you're caring for someone who has Alzheimer's, dementia, or memory loss, forget it. There was no way that I would have been able to participate, as wonderful as it sounds, and as beneficial as it is. And so to be able to offer it from the comfort of my home in a time that I am able to sign on, that I know has been very helpful. And that's actually one of the reasons why we've changed the way we deliver our trainings and our classes and our conferences for that same reason.
And even just to build on that, as you were talking about that accessibility piece, it made me think of something else that we try to do for all of our clients. So if you're listening to this and you're thinking, I completely relate to Martha, I would not have been able to drive to the class and do the class and then drive home. That's too much time. We do our best, if it's needed, to connect you to a respite care agency who could actually send an in-home care provider to be with your loved one during the class so that you can be assured that they are being looked after, they're in good hands. We can do that for in-person classes. We can even at times do that for a virtual class. If your loved one, has a really high level of need, someone can come be with them in the living room and you take your laptop to another room of the house and shut the door and they're in good hands. So we're trying to do everything we can to make sure that the class is available to as many caregivers throughout the county as possible.
Yeah, that's fantastic, and I just love the fact that we're able to help families with our respite dollars that we get from our different contracts that enable them to participate in these types of programs as well as take care of themselves, maybe take a break. Respite is so important and a key component of a whole full comprehensive care plan for family caregivers. People need to be able to take a break. They need to not only learn more things and take that time to do that, but take a break from their actual responsibilities of being a caregiver. Which brings me to a thought that I had. When families often come to us, they don't know what they need. They just know they're overwhelmed. They know they're stressed. They know they need help, but they don't know how to set it up. So I think one of the really neat things about this program and other services that we offer at Southern Caregiver Resource Center is the fact that we have professionally trained family consultants and care managers, and they do an assessment, right? They assess their needs. They do an intake. They do an assessment. They actually develop a care plan while they're going to be participating in these programs, so that not only did they participate in the program, but now they have a plan and they can work with the care manager or the family consultant to then connect to the other services so that it's not just over after the class. They can go to a support group. They can go to more educational programs. On our website at scrc.care, Martha's team has this amazing menu under the iCare portal with all the live videos and short clips, as well as live streams that are all listed there of all the different types of topics and programs that we can deliver so people can get that ongoing support that they need and continue their learning through their caregiving journey. It's so important, these assessments and care plans and things of that nature, because I mean, you get lost. You're a caregiver, and sometimes you feel you can handle it. Maybe at the beginning, after a couple years, you realize, uh-oh. Then some people come to us very later on, and they're in crisis because they haven't had help, and they're so overwhelmed that they can't even see beyond their need for support, and they don't know how to put it together.
And I think it's also important to recognize that sometimes you don't know where to begin. It's so overwhelming. It's such a daunting task that how do I even start? How do I even sort through everything? I know that's very much a common thought when your loved one has been diagnosed with some sort of a chronic condition. Now what? What do we do? And that is why it's so important to try to get as much information as possible. And even if you don't need it right now, I know that has been something that we tell caregivers, you might not need this right now, but at least know about it. So in case you do need it, or in case you find yourself just increasingly, overwhelmed, that at least you know where to turn to. And I know that in talking to caregivers, that has been something that they say, I didn't even know I needed this, and now I can't live without it.
Yeah, and we always encourage people, even if you're in the early stages, it's a recent diagnosis, things are pretty calm, that's the perfect time to take this class because that's still great. You're still learning all these skills. You're preemptively setting yourself up to have this knowledge and have these skills before you get to that point of being fully overwhelmed. So if you're out there and you're feeling overwhelmed, we can support with that. But if you're not overwhelmed, still come on over, still come take the class because we can hopefully then help you, prevent you from ever getting to that point of overwhelm. So anywhere on your caregiving journey, anywhere in the diagnosis process, as long as that loved one has some sort of memory loss, Alzheimer's, dementia, we welcome you in our Calma TLC classes and program.
Yeah, I appreciate you saying that. Southern Caregiver Resource Center, we're the leading provider of caregiver support services for San Diego and Imperial counties. And all our services are either free or at little cost to family members. But it's amazing the menu of services that we have that families can benefit from these free services. The other thing that is really wonderful about our organization is that as Southern Caregiver Resource Center is one of 11 caregiver resource centers in the state of California. So in California, which is the only state in the nation that has caregiver resource centers, 11 of us, we actually have a website, caregivercalifornia.org. So if you go to that website, you can hover. If you don't live in San Diego or Imperial, if you live in Orange County or up north in San Francisco or in Redlands or somewhere else, you can hover over on that website and see what CRC helps you. And you can also look on there and see what other educational programs are being offered throughout the state. Because as you mentioned, Kerry, everything is telehealth. And so these educational programs, you don't have to go to San Francisco to get the presentation. You just have to click on and listen to the presentation. Or if you live up north and you want to go to one of Martha's classes down here, it's the same thing. You could just click on those links and there you are. It's as if you're here with us. So it's wonderful. Well, that's all the time we have for this edition of Let's Talk Caregiving. To hear more of our podcasts, follow us on your favorite podcasting platforms or visit our website at scrc.care. I want to thank Martha for co-hosting another important discussion, our guest Kerry Rogers, and our audience for tuning in. If you are providing support to a loved one, you don't have to do this alone. Asking for help is not a sign of weakness, it's a sign of strength. To connect to our programs and services, visit our website at scrc.care or call us at 827-1008. And again, if you live outside of San Diego and Imperial Counties, visit caregivercalifornia.org. To support our efforts and make a tax-deductible donation, please go to scrc.care and click on the Donate tab. And remember, SCRC is here for you,
caring for those who care for others.
Thank you.